Hello everyone, myself Sakshi Pal. Today we'll be discussing a topic of exercise therapy 2. The name of the topic is low dog scroll. Basically, there are several types of crawling exercises. One of them is low dog scroll. We'll be discussing this type in a bit detail. First of all, let us know what is crawling exercise. Crawling exercise is fundamental developmental pattern of progression. Crawling exercise is also used by the neonatals for their progression. It involves the coordinated movement of both upper limb and lower limb. Now we'll see low dog scroll in detail. So, definition and therapeutic concept. Clinical definition. Low dog scroll is in quadrupedal locomotion progression executed on hand and foot contact while keeping the head, thoracic and lumbar spine tightly aligned and low to the ground. The dynamic posture places a heavy multi-segmental loading demand on deep anti-gravity muscle stabilizers. Core importance. As a closed kinetic chain exercise, it provides valuable clinical feedbacks, enhances CNS coordination, minimizes spinal shear strain, optimizes dynamic core endurance. Starting position of the low dog scroll. First one is quadruped pose. Align shoulder over wrist and hips over knees. Upper base, place hand firmly, shoulder width apart, fingers slightly spread. Lower base, place toes and hip width apart on the floor surface, knee hover. Tuck toes and elevate knees 1 to 2 inches off the ground. Flat spine, maintain a neutral and horizontal spinal alignment. The movement sequence, how we will perform it. First, lift breath. Assemble in starting posture. Lift the knees slightly to hover above the mat surface. Contralateral drive. Advance the right hand and left foot forward simultaneously with stability. Next is reciprocal dive. Immediately match with left hand and right foot driving forward synchronously. Fourth one is keep low. Keep breathing normally. Do not let hips raise or sag throughout the distance. Major muscle involved during this crawling exercise. A whole body compound functional integration pattern. Anterior core, rectus abdominis and obliquus. Elbow extensor, tricep brachii. Knee extensor, quadriceps femoris. Shoulder girdle, deltoids and pectoralis. Hip extensors, gluteal and hamstring, plantar flexor, gastrocnemius. Clinical uses of this is neuro re-education, restores contralateral gait signals, improves cerebellar integration and enhances overall motor control circuit. Next one is sports conditioning. It improves multidirectional strength, stabilizes the core under the movement. Functional rehab promotes wrist, knee and ankle joint loading tolerance inside controlled closed kinetic chain positions. Therapeutic benefits are it improves coordinated gait, repatterns the rotational movement between core shoulder girdle and pelvic structure. Core stabilization requires sustained static dynamic integration of local and global spinal stabilizers. Next is systemic loading highlights muscular imbalances instantly requiring symmetrical distribution of load. Cardiopulmonary conditioning raises target heart rate through low impact system muscular recruitment. Indications of this crawling exercise is balance and core deficit, person suffering from balance issues, coordination disorder, patient having neurological disorder in which they are not able to coordinate hands and legs properly, weakness rehab, person suffering, it is indicated for subacute post-injury recovery phases to build non-compressive and axial strength safely. Contraindications are acute fracture on or unstable joint, recent surgery, contraindicated post-abdominal thoracic or orthopedic surgery before complete tissue remodeling, severe vestibular disorders, head-down orientation can trigger acute vertigo, nausea, acute musculoskeletal inflammation, active arthritic flare-up, or localized tendinopathy in active joints. Safety precautions. Pre-exercise warm-up. Warm-up is important before performing any activity. Posture monitoring prevents severe hyperlordosis, wrist hyperextension, and head lag drop during fatigue stage. Fatigue control terminate set immediately upon motor alignment decay. quality of step integration must supersede total volume. Biomechanics. Low dog scroll provide a low stress, high functional environment by removing the stress of high axial gravity. Loads patient gain coordination control without dynamic spinal compressions. Clinical targets. It is an excellent tool for it combines balance, deep strength, and gait mechanics, offering high therapeutic outputs inside the simple floor prints. Conclusion. Low dog crawl is an exceptional closed kinetic chain quadrupedal coordination technique. It seamlessly bridges motor rehabilitation from developmental pattern to functionally daily upright locomotion. Now we'll see how to perform it practically.
As we discussed in the theory video, now we'll see how to practically perform a low dog crawl. So first we'll tell the patient to go in quadruped position. The final position will be inclined prone kneeling, in which we'll tell the patient to abduct their shoulders at 90 degree and flex their elbow, both the sides. Now we'll tell the patient to move in a circular motion, move forward, and we'll tell the patient to use contralateral links. Okay, so this is how you perform low dog roll. It helps in core strength. Thank you.